How much exercise is enough for us? It's a very common question that I'm sure comes to your mind, and it has been asked by many of my patients. Hello, I'm Dr. Meechal Namita, and I'm on a mission to take health to every single household. Today I'm going to give you a formula with which you can actually calculate according to your age as to how much exercise is enough for you. So before I begin, I want you to understand a very simple term called the heart rate. Heart rate is the number of times your heart has to beat per minute to circulate blood to all parts of your body. The blood doesn't only take nutrients, it also carries oxygen to every cell and tissue of the body. So there are two types of heart rates that we would be discussing on this episode today. First is the resting heart rate. Resting heart rate, as the name suggests, is the heart rate at rest. That means, say for example, just before going to bed, you notice your heart rate. At this time, your mind and body are at rest. You're peaceful. So the number of times your heart is beating at this time per minute is your resting heart rate. It is different in men and women, and it is different at different ages. I'm going to post a link below, and you can have a look that at what age and what gender is the one that is for you. Second, we talk about the target heart rate or the maximum heart rate one is supposed to achieve during an exercise to really call it a day and say, yes, I've had enough exercise today. So I'm going to give you the formula. Now listen to it carefully. The formula says that subtract your age from 220, and the number that you get should be the target heart rate that you must achieve in a single episode of your exercise. For example, let's say for a 20-year-old, 220 minus 20 gives us 200 beats per minute. For a 40-year-old, it will be 220 minus 40 gives us 180 beats per minute. Another question that now comes to your mind, I'm sure, is, but we exercise, sometimes it is more, sometimes it is less, and the heart rate that we achieve is different. Well, the target heart rate remains the same according to the age. It's just subtracting the age from 220 and you will get the target heart rate, and it will be the same for that particular age. So what is the difference? Say for example, somebody has started walking or started some form of exercise from a place where they were not doing any exercise, and initially, say for example, they are walking 500 steps on a plain surface and they reach a heart rate of say 180 per minute for a 40-year-old, and gradually after another 2 months the same person is able to walk 7,000 or 8,000 steps and reaching 180 beats per minute. Now, the same person will now be able to reach, say, around 10,000 steps after 4 months and would be reaching 180 beats per minute. So what is happening is that gradually you're building endurance not only of your leg muscles, but you're also building endurance of your heart, which is also a muscle. So you're doing more exercise, but the target that you're achieving is the same. But your heart has become stronger. How do we know that? Because it is now able to exercise more at the same target heart rate. So keep exercising and stay healthy. I want you to apply this formula, but if you have any underlying conditions that is serious or chronic, do consult your physician because they know the best for you. Otherwise, if you're looking forward to applying this formula, please drop a comment. Do share it with your family and friends and help me take health to all the households, at least as many as possible. Do like, share and subscribe. Thank you so much.